I saw one where they were going into him being a Gemini. This one's a Gemini. They're like, he's a Gemini. It's definitely him.
Two-faced, right?
Yeah.
She's a Leo. She wouldn't have done it.
You are listening to Secret Services, where we discuss the procedures nobody admits to, but everyone's curious about. I'm your host, Dr. Christopher Chang.
Okay, we're back. Another episode of Secret Services. I'm here with Jackie.
Hi.
And Carey.
Hello.
And so, Carey, what are we going to talk about today?
What everyone's talking about. Lindsay Clancy. So, there's a murder trial happening in Massachusetts right now that has nothing to do with plastic surgery and everything to do with what happens when the medical system fails to see what's right in front. Lindsay Clancy strangled her 3 small children in January of 2023. Her defense is that she was in the grip of postpartum psychosis and her providers failed her. The prosecution says she acted rationally and swiftly. We've been watching this trial, Jackie especially.
I haven't been watching, so you guys are going to do a lot of the talking.
We've been sending you all these.
Yeah, you gotta catch up.
You gotta watch the group.
I have been watching so much on TikTok. Like, yesterday was like day 12 of the trial. And it's like live streaming. So it's on like Court TV. It's live streaming on YouTube because my friend sent me the link yesterday. And I was like, I don't work from home. I would love to be watching this.
Right.
She literally was like, I think I'm going to take off work the day that the sentencing
verdict.
happens.
Yeah. It's crazy that in some states and jurisdictions, they can just broadcast everything. And then others, I think in New York, they don't. Or
Yeah.
I mean, it's like, this is like the trial of like this generation when like the trial of Casey Anthony's was ours. Like, I remember that day vividly when she got not guilty. I was like, no, this is crazy.
There's a lot of controversy online of people saying that like they think the husband may have had something to do with it. So I've gone down those rabbit holes.
Oh, we'll get into that. I'm sure.
We'll get into that. But it's just interesting because you bring up Casey Anthony, and some people are saying, oh, you're just defending her because she's a woman. And this girl was like, did you see us women defending Casey Anthony? No.
Yeah.
But we'll get to that later. Let's start with just a little mental health chat. When a patient comes in for a consult and mentions they're on antidepressants or an antipsychotic, what actually goes through your head? Does it change what you're willing to do?
Mental health is really a big issue. I think there are more and more patients that we see that are either having psychotherapy or psychiatric care. And it's a big thing, at least in this country. And there's a huge number of patients that are getting treated for those types of things, whether it's through antidepressants or ADHD medicine or anxiety things or mood stabilizing drugs. There's just a huge discipline of mental health, and it's very big need, for patients. And so I think that overall, we have a lot of them in our country. And in plastic surgery, there are a lot of patients that do have some mental health conditions,
Mm-hmm.
Yeah.
Well, this is an interesting segment. So this girl says, I'm 34 and I've been on Lexapro for 2 years. When I told my surgeon I wanted a mommy makeover, she seemed hesitant and asked a lot of questions about my mental health history. Is that normal? And should I be worried she'll turn me down?
So as a surgeon, I think that we take into account all of the medical history and the medications they're on. So some things, they say, oh, I've got no medical problems. And then they say, but I'm on a beta blocker or something. So, well, that's unusual. Why? Why would you have no medical history but be on a medicine that has something to do with your heart rate and control your heart? So if Lexapro being a psychiatric medication, you'd say, well, what's behind that? What's the reason for? So, but that being said, I don't necessarily think that it's that unusual.
No, not at all. I would say even before doing only plastics, just reviewing all my patients over the years, I would say more people are on psych meds than aren't.
Yeah.
It's very common.
I would say 80% of female patients over the age of, 30, maybe even 25, have something on their medication list that may be for mental health. And it's very normal. Yeah. I mean, think about all the kids that have ADHD medicine these days, or even anxiety medications in teenagers, and it's very common. So, I wouldn't necessarily be a red flag or be like, oh, stop the presses, we got to figure this out. It's not that unusual. So maybe that doctor was giving this patient a little bit of a pause for something else, but
Right. I feel like that Lexapro for 2 years, I don't think would really be cause to be hesitant about doing a mommy makeover.
But if somebody's going to turn you down for surgery, there may be other concerns.
Right.
Yeah. So what are you actually assessing when someone discloses a psych history? Is there anything you're looking for?
In plastic surgery terms, whether they have a psychiatric history or not, really is just, are we going to be able to meet their expectations? Are they in the right mindset to go through a surgery, to go through the emotional experience of recovery? Do they have the right expectations to be able that we could meet them, not only with what we physically produce as a surgeon and patient team, but also, what they see afterwards, how they're going to feel. So a lot of it is like, you have to feel good about yourself. That's a lot of what we're doing in aesthetic plastic surgery.
I always joke that they put on this act when Dr. Chang comes in the office. They're so calm and so normal, but I'm we see the real them. We're getting them so off the wall, and
maybe you make them crazy.
No. But I'm but sometimes I'm thinking to myself, I'm the ones that are on antidepressants and anti-anxiety, those people are walking the park. It's the ones that are natural only. I only do supplements and vitamins, and I only shower with non-scented lotions, and I'm just okay, you're the ones that maybe you need to be on the Lexapro,
right.
And maybe
you need it.
Yeah, so sometimes the ones that are prescribed stuff, they're lovely, and I have no questions about them.
Right, and I think the bigger red flag would be someone who's on a bunch of psych meds,
Right.
Like Lindsay Clancy. But if you're just doing your normal SSRI or maybe a Xanax, PRN, I don't think that's a red flag.
It's really interesting. When I was in medical school, I did medical school at NYU, as you know, in New York. And my psychiatry rotation was at Bellevue Hospital, which is the public hospital in New York City. It's really world famous for all sorts of treating crazy, weird conditions and people from around the world who are in New York City with all sorts of medical problems. But the psychiatric ward is the kind of Bellevue kind of lore. Mm-hmm. So I remember talking to people who are inpatient, which means they're really, frankly, psychotic and either danger to themselves or danger to other people and really sick. And when you talk to these people, they'll tell you stories of what they're thinking and you'll be wow, that makes sense. It's possible, I guess, you were doing this and that and that you really were that you've rationalized the whole thing. They have an explanation for everything they believe.
Yeah.
And it does seem to be logic. And then you step back and you're telling the story to the attending psychiatrist or the team of people on your med school rotation, and you're wait a minute, that does sound kind of bizarre. It doesn't make sense. But in the moment, you can really be convinced that it makes sense. So, sometimes I think that it's easy to see how that can be a trap.
Yeah. I feel the really intense psychotic people, they're very manipulative. They're very good.
Yes,
They're very good
exactly.
at that. I thought I would enjoy my psych rotation because I was oh, this will be entertaining. But I actually hated it because, it's it feels very sinister how manipulative they can be.
Oh.
And you're
Exhausting.
just wait a minute.
Oh, I thought I was going to get attacked or assaulted or beat up a couple times, especially in the psychiatric ER where they were really have a frank psychotic break. I mean, in the middle, these are all the people that are having struggles and events all throughout New York City that are just bust in or brought in the paddy wagon into Bellevue, and you're whoa, this person or this person is just so upset and they could do anything.
One time I was working in the hospital overnight and they pulled me to do to be a sitter, to sit one-on-one with someone who was suicidal. And get this, we went to high school together.
Oh.
And
Did they remember
I did
you?
not remember the person.
But
he remembered
you?
me. And I later fact checked because I was I don't remember you at all. But then I was this is really scary. What are the chances of that?
What if they're what if they started asking you questions about your family or things
my
where you
gosh.
live and stuff?
Yeah, I was
recalling that.
So did you guys talk about school?
briefly, but then I was I gotta stop responding because this is weird.
Yeah, to keep the professional
Yeah, I had to
divider
put up a wall.
here. Yeah.
I would never have
An
been able to do
emotional
that.
wall.
Yeah. But yeah, so there's psych people that are involved with this story, huh? And this Clancy thing, huh?
Oh my gosh.
Yes.
All right, so we got to give some time to this. So
Yeah, we
go
got to
ahead.
dive into this. So we'll give a little background and then we can get in. So Lindsay Clancy, she was a nurse from Massachusetts and a mother of 3.
Labor and delivery nurse, I think, right?
Yes.
Yeah. Strangulation deaths of her children. Her defense, severe postpartum psychosis caused by the medications she was prescribed and failures by her providers. Prosecutors argue that she acted deliberately. Pill bottles are now key evidence. Multiple psych nurse practitioners have testified, and the defense argues that the system was supposed to help her, made things worse. So
All right, so let's rewind.
There's a lot going on
Yeah,
here.
so this woman in 2023 had her 3 kids. I think the youngest was 8 months, and she was arrested after jumping out or taken to the hospital, whatever, after jumping out of her 2nd-story window of her house after trying to kill herself and slit her wrists. And then inside they found the 3 children who are 8 months to 5.
it was 8, 3, and 5. 8 months.
And they were all strangled
3
to
and
death,
5.
and
Yes,
she
with
admitted, I guess,
exercise
on the
bands.
way to the hospital or whatever. that she
Well,
had.
they're saying that wasn't even true.
Okay, take it away. Tell us all about it.
Well, so the like series of events is she sent her husband to go pick up food and to get medication for one of the kids from CVS. She had taken the kid to the doctor like earlier that day, and then he was gone for like 30 something minutes. And during that time, the kids were strangled with exercise bands. Then she slit her wrists, her neck, crushed up pills, drank the pills, then moved the bed and jumped out of the window. And then supposedly when he came home, she was on the ground.
Yeah.
So, you're already given the look, Carey. Go ahead.
Well, but so the thing is, that's the story. But
Right.
what
And
is
then she was
leading up to
arrested,
the
she's
story?
paraplegic or
yeah, now
something.
she's completely paralyzed. So basically, what this isn't a whodunit trial. It's basically like, yes, she did it. We're admitting that she did it, but we're trying to say that she was wrongly treated, and everything that they did basically drove her to kill her children and try to kill
It's
herself.
really sad. So she like tried to admit herself multiple times to a psych hospital and was turned away. And one of the psychiatrists that they were like cross-examining, she was like, well, when I was asking her questions, she seemed like she was answering them very normally. She seemed very aware. She didn't seem psychotic. She did not ask for any medical records, like didn't review anything. And then basically was like, you're fine. And sent her on her way.
Well, that's interesting because getting somebody who wants to be admitted for help is usually not, at least comment below if you guys have opinions about this or know a little more about, but what I remember is that if you want to be admitted, you could be admitted
That's
for
what I
help.
always thought. Like, what's
To be turned away is unusual. If you wanted to commit to Carey, I would have to prove that
Some
she's
days
going to
you
be
do.
harmed of herself or harm to somebody else, namely me. But but you can't really admit somebody else,
Right.
But if they voluntarily want to, there was always an avenue for voluntary admission.
That's what I thought.
unusual.
And also, too, it's just like we've seen this story play out so many times. Like, why didn't her husband just say, like, clearly she's struggling, whether she's just tired or, like, even if she is postpartum, like, just get her away from the kids. Like, this has happened. This happens, like, what, every 5 years? Like, a mother kills their kids. Like, like, sometimes, like, not because of postpartum, because of other reasons. But, like, the Andrea Yates thing. This is, like, Andrea Yates all over again. The husband is literally being, like, dragged through the mud because he did sound like he was just tired of it. He was like, I'm tired of dealing with her.
Well,
I also have 3 young kids.
Well,
like,
and there was one of the times she tried to check herself in, they were like, well, it would be easier to get in if you just went to the ER first. And he made a comment, well, I don't want to spend the whole day in the emergency room.
yeah.
And it's like,
Yeah.
How serious is this issue?
Right. If it's really this bad, like you didn't want to waste your day, like if that's what you got to do, then
And then apparently, like, she did say things about, like, harming the kids, but he was like, I didn't take it serious, or, like, I didn't think she was that bad. Like,
But getting back to the medical side of it, so you guys have been watching the trial. Go back to, like, because I saw literally a snippet of, like, when the doctors were on the stand and stuff. Talk a little bit about that, what that looked like when they were cross-examining the doctors or whatever. Because essentially the defense is trying to say the doctors did not treat her properly. Like
right. Well, basically, like, and unfortunately, like, this is kind of like the norm now. It's like everything is a virtual. Like, if these doctors are prescribing her insane amounts of psych meds, but like they're not seeing her in person. They're not like being able to
Were they
check.
different doctors or the same?
I believe there were a couple different ones.
Different doctors.
Yeah.
But not simultaneously, or they were simultaneously? Do you know?
I don't know
No,
if there
because
was
she was
overlap.
kind of bounce around. Like, she would go to one hospital for something, and then she tried to go to the other hospital
like she
to get
wasn't getting
admitted.
where she needed. Like, and you
Well,
know,
what she get, you said all those different. She was on like 5 or 6 different meds, right?
I think she had like
13.
12 total, 12 or 13.
Wow. So
Yeah.
was it like, Doctor 1 is giving 2 and Doctor
Yes.
2's
Yeah.
giving 3 or 4, and they didn't talk to each other, essentially? Is that what?
I guess not.
Yeah, exactly. And she
And-
kept a very detailed journal about like what meds she was taking, how they made her feel. And she was saying like when she was prescribed Ativan, she was like, I don't like the way this makes me feel. I'm feeling symptoms that I didn't feel before this. I can feel myself getting dependent on it. I don't like this. And they're just like, well, keep trying, like get over the hump,
And there's so many, like, we don't want to say, like, blame the doctor, but it's basically like they think, like, okay, here's a pill, it's going to fix you. And I think also, too, people who aren't in medicine, they also kind of think that, too. They're like, I'm getting this prescription, things are going to be better. And then when it doesn't, then they start to think, like, well, what's wrong with me? Like, why am I starting to feel so much worse?
Well, I was just thinking about the bouncing between the doctors thing, bringing it back to what we see in plastic surgery. I mean, I'm sure you guys can think of a patient or two who we've seen who's also simultaneously getting things done at another
We all thought of her.
at another place, and you're like, well, why are you getting this done? We already told you don't need to have that done, and they're getting, additional procedures, and you're like, whatever, you're already thin, you already look young, you already look smooth or tight or whatever.
Yeah.
And the patient is just manipulating the second opinion or the alternate doctor, and I mean, I'm not her parent. I can't call the other doctor and say, well, what are you doing that for? Why do you, it's sort of like, well, then we essentially have to sort of pull back and discharge from our care or say, listen, I can't really.
But I think the argument is, if she is clearly appears to be like doctor shopping psychiatrist, I think you would expect the next psychiatrist to at least like ask for her previous notes.
Or now.
But I think all the online stuff is you
I
can
was gonna
literally just
say.
sign up, get an appointment like same day and sight unseen, or like have a little Zoom call, and they'll just like prescribe you something without having access to anything.
And like, I don't know what was around in 2023. It wasn't that long ago. But even on our end, when we're putting in prescriptions for patients, even if we haven't prescribed the prescription, there's prescriptions that we see what this patient's taking. And then like when we try to send in just the basic prescriptions for these surgeries,
Everything's flagged.
I am on the phone with CVS day after day. Well, just recently, CVS in Maryland called and was like, well, why is she getting Oxy from a doctor in Virginia? I'm like, we are literally 10 minutes from the state line. Like, and you have to ask me, like, and I had to send it back in with the diagnosis code and a reason why she's seeing a doctor in Virginia and not a doctor in Maryland.
Right.
Like, it's crazy. And so the fact that this woman could get 13 medications and the pharmacist didn't.
Yeah, there was such a big thing with like the OxyContin scandal. Like, is there no like red flag in place for these psych meds?
Yeah.
I don't know.
It's interesting that the opioids get so much criticism, but I think that's because there was so much abuse and there was just so much.
Yeah, there were all those
tied
documentaries.
to
Like,
the
it was such a big thing.
fentanyl, oxycodone, black market. It's
Meanwhile,
it's
these are like
political
literally changing your brain
versus
chemistry.
clinical. Right,
Yeah.
exactly. It's like the politics were very bad. And of course, there have been some bad addictions, overdose, and that kind of stuff. But I think that the abuse of the medicine is different from the malpractice of prescribing inappropriate prescription of what you think or how they're going to interact.
Well, and then they found pill bottles in Patrick's car, her husband, and his reasoning was, well, they told her to like get rid of these pills because she was going to like start taking these other ones. But that's another like thing. Yeah, as a doctor, you can tell them to get rid of it, but how do you know they're not still taking it? They still have it.
Yeah.
Yeah.
And if it's in his car, she can get to his car. You know, like it's not like they were disposed of.
All right. Well,
We're ready for this.
we got to get into the other half of this discussion. So tell us all the conspiracy stuff that's happened. Give us the juicy.
So the trial is basically just, was she psychotic or did she intentionally do this? But now these TikTok sleuths, they are basically like, she didn't do it. He did it. Like they're talking about her Apple Watch. They're talking about.
I saw one where they were going into him being a Gemini. This one's a Gemini. They're like, he's a Gemini. It's definitely him.
Two-faced, right?
Yeah.
She's a Leo. She wouldn't have done it.
Wait, but so explain where that comes from. So what's the first
I think
evidence?
a lot. So some of the like red flags that people are seeing is when she arrived to the hospital, her core body temperature was 82 degrees.
Which is extremely cold.
Very cold. And so people are saying, well, in the time frame, you have a 30-minute window. She strangled all these kids, slit her wrists, slit her throat, drank the pills, jumped out, was found. And all that time, her body temperature dropped that much.
And then they said something about her being a nurse. Like,
Yeah, they're like, nurses, why would you crush up the pills? Why wouldn't you just swallow them whole? Like, what's the difference?
yeah. And then.
How do they know they were crushed instead of she didn't chew them?
I don't know. Maybe they saw where they were crushed.
And how would they
I don't
even
know,
know?
but
How would they
it's-
know? They pump her stomach?
Well, they did do a tox screen, and she had Seroquel in her system, like 3 times the dose of what she was prescribed, and she supposedly hadn't been taking the Seroquel for like weeks. So that was another. People are like, well, but the bottle was in his car, and she had it in her.
And then what was the one you just said
strangling thing,
about
right?
today?
Tell us about the strangling being a
Yes,
male
people were saying,
assault
yes,
technique versus a female assault.
Historically, men strangle, not women.
But then remember you said something to me earlier this morning about her, like the talking. Did we already touch base on that?
Oh, yeah. So he was saying that when he arrived, he approached her and he said that Lindsay said, the kids are in the basement. I killed the kids. I tried to kill myself. And then all the other first responders just testified saying that she was not able to speak. So everyone's like,
His account. They're questioning his account.
like he said multiple sentences to him.
So they're poking holes in
But
his
who
story.
knows?
Right.
But
and then what about
the interesting thing is like the prosecutor is also like bringing things up where we're like, all the TikTok people are like, it seems like the prosecutor is even finding like little holes in the story.
and then the CVS and the Miralax or something?
Yes. So his
alibi.
His alibi, he said, he went to CVS. She had previously called CVS asking if they had the pediatric Miralax. Supposedly they said yes. So then he goes to CVS and he says he called her because they only had the generic brand, not the name brand, and asked her if that would be okay. But then the TikTok sleuths in the photos, you can see through the CVS bag and it's like name brand pediatric Miralax. So they're like, well, why did you call her?
Oh, you mean he's on the camera, the security camera? You can see what he's got?
No. Like he brought the bag home. So like they took pictures of the crime scene. So the CVS bag is on the counter.
The evidence from the day of the crime.
Yes,
was
and
the
you can
CVS with the
see
Miralax
in the
it.
bag, and it's like Miralax brand. So they were like, well, why did you call her and say that they didn't have it if they did? But again, he's not on trial, so like that question never came up. But it's just things that people are seeing.
Yeah.
Yeah.
That's crazy. And then of course the cherry on top is how quickly he
He like remarried
bounced
like
back.
4 months later. He ran the Boston Marathon. His new wife looks identical to her.
And they have a child, I heard, or something, or they're
I
going
think
to have
they
a child.
do. I think
They
they
just
do.
had one, I think.
Yeah.
From what I've seen on TikTok.
Yeah.
But
My algorithm's screwed. I haven't seen any of this stuff.
Well, now
on
you're
my
gonna see
TikTok,
it
but
all.
now it's gonna
I
happen.
hadn't at first. Like, I think it was probably a couple of days into the trial, and I was like, oh, what's this about? And now it's like consuming my life.
yeah.
I think like the multiple providers, not cross-checking the meds, not listening to the patient. It seems as though they were brushing her off.
Yeah.
And like one of the psychiatrists told her, like, you should work out. That'll make you feel better. So then she was like working out. So then they made a note like, she's doing better. She went to the gym last week. And they were like, well,
Like she was
she's
told
just
to.
doing what,
Yeah.
that doesn't mean she's like feeling good about it. She could be like dragging herself there miserable.
Yeah. I mean, it's really hard. I mean, as Carey said, when this has happened before, so when a system, is supposed to catch these crises or the people having these breaks and stuff, what do you guys think has to happen to kind of be a better system or patient care follow-up to make
I
that?
think just in general, the mental health crisis in America just seems to be like a topic of every like tragedy that we hear about. Mm-hmm. And so I just feel like the system itself needs to be totally revamped.
Is it a purely American thing? I don't really feel like I hear about it from other countries or cultures, but maybe that's just because, of course, we just consume American media. I don't know. What do you think?
Yeah, that's a good point.
Yeah.
Are other countries as medicated as
As crazy as we are?
Probably not.
Probably not. Well, anyway, if you've got any comments and love to share, please let us know below.
Let us know your conspiracies.
Yeah.
We love reading them.
We love to hear. So until next time, we'll see you for another episode. Take care.
Thanks for listening to Secret Services, the podcast where we see everything and say nothing except right here. I'm Dr. Christopher Chang, double board certified plastic surgeon located in Tysons, Virginia. Follow us on TikTok at Congressional P Surgery or on Instagram at Congressional Plastic Surgery. To send us a classified message or to hear more episodes, go to secretservicespodcast.com. Links to everything we talked about on today's show are available in the show notes. Oops, patient's here. We gotta go.